Hi, my name is Hannah Darlington, and today I'm going to discuss acute lung injury associated with vaping. The rise in popularity of the e-cigarette started when they hit the United States market in 2006. The original purpose of these electronic smoking devices was smoking cessation. But with their acceptance among the teenage and young adult population, the opposite effect happened, with an estimated 1.3 million new adolescent users. In 2018, not only were 3.7% of the United States adult population e-cigarette users, 3.6 million American adolescents were as well. According to the article, Vaping-Related Acute Lung Injury, a New Killer on the Block, from the Mayo Clinic. In 2019, America experienced the effects of these vaping devices, with an epidemic of acute lung injury. According to the article, E-cigarettes, vaping devices, and acute lung injury, in the early summer of 2019, there was an outbreak of respiratory disease. Over a period of approximately 6 months, more than 2,600 people were sickened, more than 50 people died, and one person even required a lung transplant, all related to lung injury caused by e-cigarettes. Despite the outbreak, there are not any current regulations to prevent similar outbreaks. Due to the lack of regulation on these devices, they come in all different shapes and sizes. But according to the article from the Mayo Clinic, the structure of these e-cigarette devices are essentially the same. The devices contain a variable voltage battery, heating elements or coils that function as an atomizer, converting the e-liquid into an aerosol, a reservoir or vaporizer chamber for the e-liquid, and a mouthpiece. The aerosol comes from the heating process of a solution called e-liquid that may or may not contain nicotine, as well as other compounds like propylene glycol, vegetable glycerin, flavoring agents, and additives. When inhaled from the mouthpiece, the aerosolized fluid is delivered to the respiratory tract. Acute lung injury is an umbrella term that includes injuries to the bronchial tree, alveoli, and lung parenchyma that result from the inhalation of hazardous substances. These injuries may result directly from the physical properties of the inhaled substances, such as the temperature or the size of the suspended molecule, its chemical structure, or direct contact with the toxic components of the vapor. The extent of the lung injury also depends on the type, duration, quantity, composition, and physiochemical properties of the substance inhaled. According to the article, e-cigarettes or vaping product use associated acute lung injury as a therapeutic problem in anesthesiology and intensive care unit departments. Although e-liquid contains seemingly harmless ingredients such as propylene glycol and vegetable glycerin, substances added in food that aren't toxic when absorbed by the GI tract, but when heated, they decompose and generate potentially harmful carbonyl compounds that have been implicated in the development of oxidative stress and release of inflammatory mediators, increasing cardiovascular risk, airway epithelial injury, and creating disturbances in gas exchange function. Direct toxicity may also affect pulmonary endothelial vessels and alveolus structure, leading to rapid gas exchange disorders. Furthermore, exposure to flavoring agents causes disturbances in the epithelial barrier and cellular function of the lungs including reduction in the ciliary beat frequency, leading to diminished mucociliary clearance and impairing mitochondrial function. Unfortunately, patients presenting with acute lung injuries in the hospital, they had nonspecific symptoms such as cough, dyspnea, and or chest pain with a quick onset of a few days to weeks, and may include other symptoms such as fatigue, fever, weight loss, or gastrointestinal issues. More than half of patients were tachycardic with an oxygen saturation of more than 95% on room air, in the absence of an infection or other plausible alternative diagnosis, along with all patients presenting with abnormalities on their chest x-rays, with ground glass opacities consistent with acute lung injuries. Pathology samples were also consistent with acute lung injury, including diffuse alveolar damage, pneumonitis, and organizing pneumonia without a predominant form, according to the article from the Journal of Respiratory Care. Ultimately, in 2019, the Center for Disease Control was able to link vitamin E acetate to e-cigarette-induced acute lung injury. Initially, the CDC detected vitamin E acetate in submitted marijuana vaporizer fluid samples, and eventually confirmed with patient history of smoking in the past 90 days. 48 out of 51 bronchoalveolar lavage samples taken from patients hospitalized with acute lung injuries contained vitamin E acetate along with THC. Although little is known about vitamin E acetate, it has been postulated to disrupt alveolar surfactant, which leads to decreased surface tension, alveolar collapse, and lung injury. Unfortunately, there is no recommendation on dose, duration, or invasive versus non-invasive measures to treat e-cigarette associated lung injury. It is on a case-by-case basis. Broad-spectrum antibiotics, steroids, and generalized supportive care is what's recommended to treat these patients until they are stable enough to have an oxygen saturation of greater than 95% on room air. The problem with acute lung injury associated with vaping is that there is a lack of research, especially in devices containing marijuana, because it's not federally legalized. This also contributes to the injuries caused by the devices sold under the table, containing harmful ingredients such as vitamin E acetate and other substances used as a filler. Without regulations, companies are able to market vaping devices as safer alternatives to smoking, promoting flavors and instilling habits on the younger population, like adolescents who didn't have a smoking problem in the first place. Therapists treating patients with these conditions are at a disadvantage due to a lack of evidence-based medicine. More research needs to be done to determine how exactly substance like vitamin E acetate affects the lungs and how these chemicals interact with the lungs. Better research will lead to better treatment of these patients, and even better, how to improve the design of e-cigarettes to fulfill its original purpose in aiding in smoking cessation.